Good afternoon, everybody. This is a very unusual format since I can't see all of you who are here. My name is Dr. Toluwalase Ajayi. I go by Lase Ajayi. Myself and my colleague Lauren, who's going to introduce herself, are going to be your moderators today. We're going to be talking about a community research project that really relies on the community and looks at our participants as partners in our research. And we also talk about maternal health and morbidity and mortality and what we're at Scripps Research are doing about that. I'm going to take a pause and have Lauren introduce herself.
Hi, everyone. Thank you so much for joining our session. My name is Lauren Ariniello, and I am a project manager over at Scripps Research and help support a lot of our digital trials, one of which is PowerMom, which we're excited to tell you more about today.
Excellent. Thank you, Lauren. Lauren is going to be monitoring our chat. But before we get started, and the kind of presenter that we are and how we do this, typically we'd like to know who our audience is and who we're really talking with. So I'm just going to have you guys unmute really quickly. And if you guys want to take a look, and I'm looking to see right now in our participants, it looks like we have about 12 people here. If you guys want to just unmute and let me know who in this group are identify as female in this, who are in this chat. Just go ahead and say I if you do. I think you guys should be able to unmute and just, if you identify as a female, just unmute and say I do.
Hi.
I've got one brave soul.
I do.
Anyone else feeling brave? Okay, anyone identify as male in this group?
Hi.
Thank you. Okay. Anyone identify as transgender? And anyone identify as non-binary? Okay. Now within this group, can you unmute and say I or hello or something if you have children?
I do.
Right, thank you. Anybody else? And if you're feeling shy, you can also use our chat function on the Live Well San Diego platform, and Lauren can monitor that as well. For those of you who don't have children, are any of you interested in having children?
Yeah.
Okay, one person. I'm going to assume there are more, and you guys are shy and quiet for now.
Yes.
Oh, okay, more people. Thank you. Thank you for participating. This will be a fun, dynamic conversation. And again, if you're feeling a little bit nervous and prefer to just chat in the platform, Lauren can ping me for any comments that we have. But again, this session is about you as well as it is about us and telling you about our research. Before I get started, for those of you who are here in the audience, not many of you may have children, or maybe you're thinking about children, but I know most of us at one point have been patients in the hospital. And I want you to take a moment and think back to the last time that you were in a hospital. Think about the support or that you were at the doctor's office, and think about the relationship you had with your care provider or the support person that you may or may not have had at the hospital, the doctor's visit, midwife visit, wherever. Imagine that. Now, I want you to shift your focus and imagine that you are now one of your most vulnerable moments and you're scared. You are in amount of pain, intense amount of pain, and you have to go to the emergency room. And you don't have anyone to take you to the emergency room for whatever reason. Maybe your support network are all working. Maybe you don't have a support network, but you end up in the emergency room alone by yourself, and you're scared, and you don't know what to expect. You're scared because of what's going on inside your body, and maybe also you're scared because you've heard stories or rumors about what happens when someone like you goes to the hospital, right? Maybe you've heard stories about the negative outcomes that could happen when you go to the hospital. You just want answers and you want help, but you don't know how to ask for it. You don't have the words for it. That's how a lot of women, a lot of pregnant people feel in the United States. I'm going to go into the numbers a little bit later, but I will tell you, for Black and brown pregnant people in the United States, having a baby can be a scary event. It can be a joyous and loving one. But because of our healthcare system and because of our maternity rates, maternity, morbidity, and mortality rates in the United States, it can also be a scary situation. You don't have that person there with you, and you don't know what's going on with your healthcare system. At Scripps Research and PowerMom, we're working together to try to find answers for why we have such high rates of mortality and morbidity in maternal health in the United States, because it shouldn't be this way. As one of the richest nations or countries in the nations in the world, we really should have better outcomes than we do. Our goal here within PowerMom is to build, and my computer fell asleep, but our goal here is to partner with the community, lots of communities across the United States, and advocacy groups to build the largest, most diverse pregnancy-related community, so that as we gather this information, we can actually reduce the health disparities that happen and also provide a support network for pregnant people across the country and improve the health of the mom and the outcomes of the baby. Why do we care so much about this? As I said earlier, the United States is ranked number 1 in maternal mortality and also morbidity. What do I mean by that? I mean that over the last 20 years, the risk of women getting diagnosed with things like high blood pressure during pregnancy, getting diabetes during pregnancy, having a condition called preeclampsia, you have headaches, you get sick, that can affect the way that your baby's born. Those rates of those things have increased by 200% over the last 20 years. In the United States, 17.2 deaths happen per 100,000 live births. That's a lot, considering how many people are born even here in San Diego. And what's interesting is, we're also the only developed country to not guarantee access for home visits. So for those of you who haven't had children, imagine you just kind of push life into this world, right? You're sore, you're achy, you're tired. And either you have to go back into your doctor or your care provider, you have to bring your baby in to their care provider 1 or 2 days after birth. You just got home from the hospital and you have to go back and go somewhere else. You're in pain, you're uncomfortable. It's kind of crazy that things that can really be done at home aren't guaranteed. And if you do have the privilege to have that, oftentimes you have to pay out of pocket for that luxury. These numbers are stark, but also when you think about it, the people who carry the burden of this mortality, of this morbidity, having this increased rate of disease, are pregnant people from underrepresented backgrounds, in particular, Black and non-Hispanic white pregnant people. We know that Black pregnant people were more than 3 times likely to die in the United States than their white counterparts. more than 3 times as likely. That's huge. We know that since 2018, across the United States, there's been an increase by 19% of Hispanic women who get preeclampsia, gestational diabetes, etc. What's not in the slide also is, we also know that Black babies in the United States are actually also 3 times likely to die than their white counterparts. We know that Black and Hispanic women in general are more likely to have these risk factors. So we have all this information, and apparently we've had all this information since 20 years ago, and yet these numbers keep increasing, yet nothing really seems to change. Why is that? At Scripps Research, we think that part of that is because we're missing these voices from research. Research drives how healthcare is provided, right? We like to practice medicine with evidence-based medicine. So if there is no evidence behind the care that's needed, how can we change the protocols? How can we work with our legislator to change policy, to change reimbursement, to change how care is accessed and how care is changed? Historically, pregnant people in general have been underrepresented in clinical trials and research because we're seen as a vulnerable population. And I say we because I have a 8-month-old now at home and a 4-year-old. So I've been through this process myself. We also know that in those disparities, it's even more profound when we look at pregnant people of color, less likely to be included in clinical research. And there's a lot of reasons for this, right? Traditional research makes you go someplace. Either you have to go to make an extra clinic visit, or you have to go to the care provider an extra time, or you have to go to some research building. You have to somehow disrupt your life to participate in this clinical trials. And when you're pregnant, you're tired, you're working, you may already have other responsibilities with the children, having to participate in research that makes you go to them makes it that much harder. It's time off of work. It's exhausting. You're tired anyways. However, this missing participation leads to disparities in representation in the clinical research. It means that when we make clinical standards, when we say something's the gold standard, really only looking at a small population. And that population isn't really as representative of the population that's pregnant here in the United States, because those voices aren't heard in the clinical research. So how can we change that? Well, let's use a tool that most people in the United States have. So right now, looking at the data, we know that 63 and really 65% of pregnancy-related deaths are preventable. If you could screen them or catch them early, if we can identify the populations at most risk and what makes them at most risk, if we can change the way that we practice medicine and stop being reactionary and more be preventative, and maybe change our screening guidelines and catch these earlier. We also know that 90% of pregnant people, childbearing age, own a smartphone. Broadband access changed that a little bit, but even that with the new infrastructure bill is hopefully going to get better. But we know that right now, 90% of pregnant people in the United States own a smartphone, and that's consistent amongst Black and Brown and pregnant people as well. So how can we use a smartphone to empower pregnant people with their own data, use this information to reduce health disparities, and really build a healthy maternal community for everyone? How can we do that? Well, why not launch a study, a research trial you can enroll in, participating on your own time from your home as is convenient for you. That's the vision of PowerMom. PowerMom was a brainchild of my colleague, Dr. Jennifer Radin, and really a group of us here at Scripps Research, when Jennifer and one of our colleagues, and actually myself, were pregnant with our first children back in 2017. And our colleague's wife was being told that, hey, you're not getting enough weight, your baby's going to be small. And she's saying, you know, this is how people in my family, my culture look like during pregnancy. And we thought, why are we ascribing a one size fits all when every pregnancy can be different? Every pregnancy is unique. can we personalize medicine based on information that we gather? So we launched this study back in 2017 called PowerMom that really allows people to join the study from their smartphones or really internet access. They fill out some survey questions throughout the course of their pregnancy. And if they happen to have a wearable device like a Fitbit, Garmin, Apple Watch, whatever, we also captured their activity level. They got to choose how much information they give us. And we use that information to then find out, okay, what were we missing? What didn't we know about this pregnancy population? We were able to, again, completely unfunded, just with a lot of people passionate about the study and our friends from WebMD that allowed us to put this app, research app, within their website. And that's how we got participants. So really within about 13 months, we enrolled over 3,000 pregnant people from across the United States. And our pregnancy population was actually more diverse than the US population, pregnancy population. We had more participants from rural zip codes. We had 25 participants that were non-white. We had 50% who were overweight or obese, and 4% that were over 40 years old, what they like to call geriatric pregnancies. I can say that because I'm 40, and I was in that category. We had over 14,000 data points about activity, blood pressure, things like that can really inform how we change pregnancy. And we were excited. With this number, imagine if you had some more funding, what we could do with this. If we had more funding, we can actually scale even more nationally, right? We could maybe even get some devices and provide those devices, Fitbits, Apple Watches, whatever, the new Amazon devices, to lower SES participants who do have some access to broadband. We can make this app, which was initially only available on Apple devices, we can make it available on Android and Apple devices. We could maybe even provide some in-home things like scales, blood pressure monitoring, really expand how much information our participants can contribute without having to work extra hard, without having to do more work for them. If it's already in the home and there are things that they would use naturally, they can use it and sync it wirelessly into that device. We could find out more questions, right? We could find out, for example, what is the impact of systemic racism in the pregnancy journey? How do health disparities factor into the outcomes that we see? And exactly what health disparities? Could we do home blood pressure monitoring? Could we actually do urine tests that could actually get those results within this research app? And what could we do about maternal health and wellness during pregnancy and then the postpartum world? Well, luckily, in 2019, we got some more funding. We got some more funding to really beef up what the app can do, what the study application can do. And we relaunched PowerMom in July of 2021, this year. Took a lot of people working on it. Myself and Lauren are just a small part of the team that's working on this. We were able to revamp the app so that this app becomes a resource that pregnant people can get information about what's going on during pregnancy, tips about exercises, dietitian, nutrition, et cetera, but more so it allows the participants to actually see what data they're giving so they can track their blood pressure on the app. And when they go see their healthcare provider, whether it's a midwife, nurse practitioner, physician, their support person, if that's their significant other, if they have a doula, they can work with them to trace kind of what's happening during their pregnancy seamlessly. And when they notice something that's different for them, they can go to the doctor or the emergency room or whatever and say, hey, I know this may fall within a normal parameter for the numbers that you guys have, but I've been tracking my information for my pregnancy and this is different for me. Something's not right. Can you look more into this? We want PowerMom to be more than a data collection. We want it to be helpful for our participants, which is why we bring them as a partner, right? What can you use as a tool to help you be heard when you go see a physician? When you go see a nurse practitioner, that's not your typical one. When you have a support team that can follow the trends that you're enrolling into the data and they can say, hey, something's going on. Maybe you have to go to a high level of care. Or hopefully, hey, things are going well. you can continue your home birth journey if that's what you want. To use as a tool to advocate for the pregnant person and contribute to research to really help create a better pregnancy for everybody. We were able to do that. One of the fundings that we got was from FitBit. One of the first studies that we can do from this platform, thanks to the funding from FitBit and hopefully another NIH grant, helps us look at the influence or the impact of structural racism on the pregnancy journey. So why would you think that structural racism affects pregnancy in general? We know that some of the mortality and morbidity that we see in this population is unexplained by SES alone. Some of you here may have heard about Serena Williams and the fact that she almost died because of a blood clot. And she went to the emergency room and she went to her physician and was in pain and was not believed, right? Serena Williams, one of the greatest athletes of all time, still became a statistic, right? She suffered one of those morbidities that we see, and she could have had a worse outcome had she not been who she is. So it wasn't about money, it wasn't about power, it was something about her and the fact that she wasn't believed. So let's take a deeper look into that. Right here with this image, I really like this conceptual framework about how structural inequities and structural racism really affects the pregnancy journey. We know there's certain factors about determinants of health. For example, the policing that happens in certain neighborhoods. What resources exist within a neighborhood? Do you live somewhere where you can walk to the grocery store, have readily available access to fruit and vegetables, a community park, someplace that makes it easier and safer for you to exercise and actually just be within your community? We look at health and income and education as well. Do you own your own home? Are you in an area that's been redlined? There was a great story recently about San Diego and the racial compacts within houses, certain neighborhoods within San Diego that even says that if you're a certain race or ethnicity, you could not buy a home in this area. How does it influence? How do those everyday inequities or racism really affect the stress that we feel within our body during pregnancy? How far do you have to travel to go see your healthcare provider? Are they able to come to you? Do you own your own car? How long does it take you to get there? Do you have to use what transportation? We talked about education as well, right? So we'll look at the care team that you have, how these things affect your systemic and your settings, and really how all these work together to affect the person and the little person that you're carrying inside, right? So your health before pregnancy, pregnancy prenatal care, all the way to ongoing maternal and pediatric care. Now, within our study, we're not able to do ongoing unless you choose to continue and do other different subsidies with us. But once you enroll in PowerMom as a partner, we follow you as long as you allow us to, but up to at least 8 weeks postpartum. So we care about the baby as well, and we care about the outcomes from the baby. Within this study, we invite non-Hispanic white, Black, and Latina patients who are pregnant to enroll in this study. Once they're enrolled, we actually give them a FitBit Lux. We chose the FitBit Lux after kind of trying out different FitBit devices. The Lux is very lightweight. I have one. You actually kind of forget that you have it. You can fall asleep with it, and it has a long battery life. We give you guys a scale. We give participants a scale. This information is synced wirelessly and pretty easily into the PowerMom app. So we use these devices as a way to kind of tell us, as you're experiencing some of these things here, how is your body feeling about it? How's your heart rate doing? How's your stress score? How are you sleeping? O2 saturations, things like that. So for this study, we give the participants these tools to passively collect this information that tells a story about what's going on within their body. Then, in addition to the questions we asked during PowerMom, we also actually narrow in, and a couple of times during each trimester, we'll ask them questions about their neighborhood. Is this a neighborhood they feel safe in, they feel comfortable in, they feel welcomed in? How cohesive is their neighborhood? We ask questions about resources within the neighborhood. Access to a park, are you able to walk at night, grocery stores, things like that. Then we also ask questions kind of about everyday racism. You know, do you feel like you have to work as hard or twice as hard as your counterparts? Do you feel like you're treated with respect when you go to the grocery store or restaurant? Things like that. And then of course, we always check about outcomes of the baby. How did you deliver? Did you have a C-section, vaginal delivery? Was it at home, in the hospital, things like that? So we gather all this information, not just from what the pregnant person tells us, right? But also what's happening within your body passively. We collected information. And we hope that this will actually help us learn more about, in general, what makes a healthy pregnancy. Studies like this, like PowerMom First, which is a sub-study of the PowerMom platform, can't happen unless we get the app, we get this research in the hands of pregnant people, right? So we partner with community advocacy groups, physician offices, really anyone that will partner with us, to get the app into our participants' hands, to really make this a powerful tool. Because otherwise it's just a really fancy, pretty app that I'm going to take you guys through so you can see what it looks like. But the power of PowerMom comes from the moms, and it's working with our communities to reach them. When I say that we partner with communities, I mean that after obviously we signed a data use agreement, but we want to share this data. We want to share this data with people who look at postpartum depression, who may be focused on breastfeeding, who may be focused on, okay, how do we increase this type of resource, but we need information, right? We're happy to share the data that we collect. It's not about us. It's about giving back to the community. It's about giving back these results to the participants also, right? And I should have mentioned that. So part of the study is as we get these insights, the participants get like information like, oh, 30% of the participants answered this question like you did. So they get those insights back, but then we also partner with different OBGYNs, midwives, doulas, whatever different organizations that partner with us, we share that data with them as well. Because again, the goal is to inform and support maternal health research. That's what we want to do. And take a pause really quickly. And I want to show you what the app itself looks like. So hopefully you guys are able to see, and Lauren, I'll just kind of have you say yes, they can see kind of what a screenshot of what the app looks like.
Yeah, we can see it.
Excellent. And hopefully you guys are asking questions in the chat. I'm going to pause and have this be more interactive just a second. So once participants decide that they want to actually even just learn more about PowerMom and see if this is a good fit for them, they're at home, they're pregnant, they hear about this from their support groups, or they hear about this from their midwife, their doula, their OBGYN, and they say, okay, what is PowerMom? They come to the screen after they download the application. This is kind of like their welcome screen. They'll click next. Maybe. There we go. And they'll go through some of the screener questions. So we do, because again, teen pregnancy, add to the numbers that I talked about. So we do enroll participants who are 16 years or older. And these are all IAB approved with our research institution. So if they're 16 and older and they have their own smartphone, they're able to enroll in the study. Right now, because of our research kind of review board, we're limited to the United States. Hopefully once we reach a critical mass, we can actually expand beyond the United States. But right now, you have to live in the United States. It is a bilingual application. I'm going through this in English because I speak and write in English, but it is bilingual as well. So you meet this criteria. Now, I said that we follow pregnant people and we also interested in the postpartum period. So let's say that you're not currently pregnant. Then we ask you, have you delivered a baby in the last 8 weeks? If you answered yes, then you're eligible to join the study. So either you're currently pregnant or within that 8 weeks postpartum, to be eligible to be a participant in the study. You get this welcome screen, and then we tell you a little bit more about the study in more detail. You don't have to go to a research facility. You don't have to go to a clinic or anything. You can actually read through the informed consent at your comfort of your own home, sign the consent, and we'll take you through more information. So we keep your information private. Our app is as secure as any other app that you use on your phone. We don't sell your information to third-party groups or anything like that for profit. This is all dedicated. We work with people who want to improve the lives of pregnant people. It's flexible. You fill out surveys, and then you can sync in your smartwatch or activity tracker if you have one. If you enroll in different subsidies, like this is structural racism when I talked about, you're actually eligible for us to give you a device. You can choose to leave the study whenever you'd like. You can choose what questions to answer. Obviously, we want you to answer all the survey questions. And again, we're very mindful of people's time going through pregnancy while developing the study and working with our participant advisory boards. We actually work with currently pregnant people, recently delivered pregnant people, to make sure our questions are succinct, but they give us information that we are looking for, so we don't take up too much of your time. It doesn't cost anything in nonprofit organization. So we go through the informed consent. You can see here, you choose to enroll, or you may go like, you know what, this is not for me. But if you choose to, enter your name, whatever email address you feel comfortable with. And this is just for us to be able to email you, check in with you as needed. And it takes you to the welcome screen. The welcome screen, the first thing you have to do is do an intake survey. Ask for your due date. If you don't know your due date yet, because you just found out you were 6 weeks pregnant and you just kind of peed in that stick and you found out, oh my gosh, I'm pregnant. So you can skip this question, talk to you have your first, after your first provider visit. We ask some demographic information about you and the father of the baby. Obviously, there's a choice to know they subscribe me, or you can choose not to answer the question. We get education information, and then we get the zip code. The zip code is particularly important because, again, as we look at low resource areas, we can look at those outcomes, and it helps us say, okay, these areas clearly need more resources. These are the type of resource, this type of resource is needed, and let's look at the outcomes and let's provide the help they need in that areas, which is why we actually ask for that zip code information. Height, weight, boom. So once you fill that first initial screening survey, then you get more personalized information. You can actually kind of see, oh, you're in your first trimester, your due date is December 17th, that's actually coming up. We should really fix that. This is a test app. And so you can see there's different articles that we go through. We ask for a health history survey, so you can give us more information about basic pre-pregnancy information, connect to other devices. You can also choose to share your electronic health records with us. Again, this is all de-identified. When I, as the principal investigator of the study, gets this information, I don't know Jane Smith, I actually just get a serial number and then this information as I'm analyzing that information. So they can choose to connect. And then we have different resources. So if you're worried about, sleep or exercise during pregnancy, maybe you're looking at postpartum wellness information, sleep for the baby, resources to help with lactation, breastfeeding, or bottle feeding, pumping, whatever, birth control. You have different resources that you can look at as well. Just kind of a quick type of information that we have in the resource tab as well. So that is a quick look, and I'm going to stop sharing and kind of see what questions you guys have as community members, as potential participants. What do you guys think about this? How usable is this? What are your thoughts? And just so you know, I only built in about 30 minutes of me talking, and the rest is to really engage with you as participants and kind of make this more informative.
Hello,
Hi.
Can you hear me?
Yes.
Hi, my name is Nydia. I'm with the oral health program with the county. And I love that app because I wanted to, in fact, I had that idea. I went to another oral health presentation and pregnancy seminar yesterday, and they were talking about how can it, and it was nationwide, how can you improve bringing the message about oral health to the pregnant moms. And so we're working, and the County of San Diego is working on doing messages, a different message every month, but we have our own platform. And so I wanted to integrate these messages, the county messages, with your program. It would be awesome because a lot of young moms don't think that your teeth are connected to your body. So, and it's so important because you go through hormonal changes and the bleeding, and it's safe to see a dentist. So I think that even, to stop smoking, and, all the factors that are important when you're pregnant. And so I wanted all your information to see, maybe later on we can talk. So
I would love that. I'm actually supposed to meet with Josephine within the county. We're supposed to meet this Friday to be a partner with the county because these are the type of resources that we want to promote. I will say also, I guess I didn't mention this. I'm a pediatrician and a pain physician. And I will say, when I was pregnant with my first daughter, I went to my dentist and I had no idea that my gums, because of I'm again, physician, had no idea that, oh, I'm more prone to bleed because of my pregnancy. Like how much more important oral care is, especially when you're pregnant. And so because I actually had my regular visit to my dentist, I did not have any of those complications, which a lot of my parents did. And I was like, why is this? So that is so true. And my hope is that by partnering with the county, we would love to share the resources the county has and actually have that in our resource tab, and also have the county promote this app as well to get it in the hands of more pregnant people. We would love that. So yes, please take my information. It's in the speakers portal, as is Lauren's information as well.
yes, yes, yes. And it's important that moms know that cavities are contagious. So I'm so excited. Yes. So we will work with you, and I guess you'll speak to people, but ask them questions, and maybe they can give you more information. It's about providing presentations to your clients, and having little videos, and if they don't have insurance, and some, even after they have the baby, they're still covered up to 90 days for dental, treatment. And so, and then they should know about the programs that the county has for the children. It's like, it doesn't stop. It's just the beginning, and watching their gums, and, wiping their gums after you nurse them. There's so much, but I'm really excited. So yes, I'm looking forward, being part of your app.
That would be great. And honestly, you gave us, and this app is continuously, like, we are active in it. So we're continually improving it. And what you just said is a blind spot that we have. We actually, Lauren, please make a note that we should put in our resource tab during the pregnancy, oral health as part of our resources information. We can definitely link the county information, but that's a blind spot. So thank you for helping us make this app better by just that comment and question. That's so helpful to us.
Oh, thank you. I'm really excited because that was my idea that popped yesterday. We need to connect with the providers and see we can be part of we can give our messages to because I know that they remind their patients, you have an appointment tomorrow, and especially the young moms, they're connected to their phones. They don't want to talk to nobody, they just text everybody. So I think the text, and we need to take care of social, be part of social media to benefit their health, and to educate, and to share with their buddies who are pregnant, to spread the word.
Absolutely. Pregnancy health all around, from the head all the way down to the toe. Thank you so much for your comment. And all those, for people, as you comment, please introduce yourself, kind of who, just like she did, your name and kind of who you're representing and your question, please.
Lase, there's a question in the chat here. When do you anticipate to close the study, and when do you expect to have preliminary results available?
Great question. So our study opened, like I said, in July 2021. This is going to be an ongoing study. We're not going to, so our goal within Scripps Research is actually to enroll 100,000 pregnant people from across the United States. Once we have that critical mass, which I'm seeing is going to be at least like when we enroll our first 2,000, I'd like to be able to give that kind of feedback to the participants who've downloaded the app. So even if you've delivered, like you enrolled at one point in the study, but you've delivered, you still have the app in your phone, as we have some of the insights that we're hoping to gain, kind of push that out to the participants within the app itself. So I think right now we're still kind of trickling in enrollment. We have 100. My hope is that when we have make the big press release with our partners. So I should mention that our partners currently include March of Dimes, Microsoft. We have the African American Center for Wellness, and I shortened that name. Lauren, we have a lot of partners. I think I already said Microsoft. There's more. There's a lot, and I can't name them all. But we have a consortium, so people that are working with us kind of get the word out. So short answer is, my hope is that maybe end of Q1 of 2022, depending on how many participants we have enrolled so far, we can start pushing some of those insight out to our participants. And then like the big peer-reviewed papers and things like that will happen later on in 2022.
Another question in the chat was if this app is currently open for any pregnant person to use, and indeed it is. I just left some information in the chat. The best way to access the app is to go to our website, and I put a link there in the Live Well platform to that. And there's links to both the iOS and Android version of the app on our website.
Thank you. Did any more questions come through?
There aren't any other questions. I was going to mention, since the app is ready and available, if you yourself are pregnant or know anyone that's pregnant, please, share this information with them. We welcome all pregnant people as long as you're over the age of 16 and have access to a smartphone. You're eligible to participate in the study.
And we do have that. We have 100 FitBit devices just in general for our first 100 participants who are pregnant and join the study. And then within the structural racism sub-study, which is off the same platform, if you're eligible, I'll kind of give you a notice and you can get that free FitBit Lux and the scale to be part of the structural racism study. For those of you who are in the audience right now, are there things that you would like to see integrated? So I appreciate our colleague from the county talking about oral health, which is a blind spot that we have. For those of you guys who are here, are there things that you think that should be included, or you wonder, I wouldn't feel comfortable providing this information? Can I use you guys as our virtual advisory group? What are things that you guys think are missing or that you would like to see?
Hello, this is Nydia again. I like talking better than typing.
Please, yes. Unmute and talk.
Maybe nutrition, more nutrition in there. How much fiber and have they eaten? Fiber have they eaten? Just a balance, like a nutrition option. Exercise, have you walked? How many steps have you done? Or things like that. Or
we definitely wouldn't ask those questions, but we can provide resources that show, these
yes.
are the general guidelines. Absolutely. And what's great about it is like we can actually passively collect how much they're walking. And if they choose to share that information, they can actually see it themselves in the app, but definitely providing those resources about, because I know I had questions like, hey, full disclosure, how much did I exercise? When can I not have sex? When I can have sex during pregnancy? Things like that. We actually have resources like that you may not want to ask your provider, maybe, kind of curious about, or things that like may pique your interest, then take back to your healthcare provider to ask them more questions about that.
Yes, thank you. That would be, helpful for the mom and the baby to have that nutrition education, maybe.
Absolutely.
A couple of people are answering your question in the chat, Lase here. One was resources for the partner to bond baby and mother, and then also information on local resources for postpartum.
Good. That makes me feel pretty good. We actually just updated our resources. So we have some information about mom and baby bonding, but I actually don't think we included things about the partner bonding, right? The person who's not carrying the baby, how to help your significant other or your partner bond with the baby. That's a missing resource that we don't have. And what was the second one, Lauren?
And the second was local resources for postpartum information.
Yes, that we do include. So we kind of provide in general information about what postpartum depression is and postpartum wellness in general. And then we were able to actually locate some pretty cool centralized resources, helplines, things like that, as well as kind of how do you know when to contact with your own primary provider. So we do have that information included in our resources. And we can make sure that we can go back and we look at those resources and make sure they're more, that they are personalized kind of to what different levels are. So you may not feel comfortable going to your provider right away. Maybe you want to do some screening questions first. Maybe you want to share those with your significant other who can actually help kind of rate and say, hey, I think maybe it's time. We can include that. We do have another one of our partners who is working with us to fund another sub-study, and that actually looks at postpartum wellness. And so there's an intervention that's offered through PowerMom if you choose to enroll. That's like maybe you're after you had your baby, like I just need a break, or maybe like, you know what, this is kind of cool, and I can earn more money by participating in the sub-study. This one will kind of pay you to provide information about postpartum wellness and also allow you to access an intervention that can actually help with your mental health postpartum. And that sub-study we're hoping will start in February.
Another suggestion was breastfeeding education.
When you said breastfeeding education, you kind of mean if you could link to videos, perhaps it'd be helpful, or maybe even how to access breastfeeding classes.
Yeah, this is Nydia again. Yes, because the county also has those resources.
Mm-hmm.
They have information about breastfeeding if you're breastfeeding and you cannot continue breastfeeding because you're sick. They also have resource information about where you can get milk, who's donating breast milk for your child, and it's just lots of information. Maybe just a link to where they can get more connection with the breastfeeding component of because this is not only just breastfeeding education, it just tells you the benefits. It tells you, okay, if you can't breastfeed, the policies that you're able to take the pump to work and have private space to, there's just all the details about breastfeeding.
Absolutely. We definitely currently have a link about how to locate because again, this is a national study, so open to anybody within the United States. So we do have a link that helps you find a breast milk bank locator, but also having kind of county specific to those who live in San Diego County. Perfect. We can definitely link to that.
There's also a comment here about possibly providing information on genetic testing and having participants understand why it's done and what it means.
Another blind spot that we have. That's excellent.
Yeah, and also commenting on the benefits and risks and what types of tests are available.
Kind of a genetic testing FAQ. That's really helpful. Thank you. Identified another one of our blind spots, which is funny since we work at a genomic institute that we did not have a resource for that, just guidelines. Thank you for that. We're definitely at 10 till the top of the hour. This is the time that we had planned. Thank you all for your suggestions. This is as much as about working with the community to help us continue to improve this research app as it is to get the word out and to have more people use it, because again, the power of this app comes from the participants. It comes from our moms. And the more people who are on this platform, the more information we gather, the sooner that we can push out information to our participants and change the way that healthcare is provided to pregnant people in the United States. So thank you so much. Thank you for my partner in crime, Lauren. This study is something that I'm passionate about as someone who faced racism herself within her own healthcare system. I know what it's like, and it's why I'm passionate about this project. It's why I think that when we take care of our most vulnerable, our most at risk, then we do a better job for everyone in general. And that's, again, that's our goal. So thank you all for your time. Thank you for your participants, for your participation. If you have any questions or just in general comment or organizations that you want us to link up with and partner with, please don't hesitate to let us know. Thank you all so much.